One of the key clinical issues with patients with metastatic melanoma is what sort of imaging surveillance should one do to monitor for cerebral metastases. So for patients with stage 2B and above disease that have been completely excised with surgery, so stage 2B, 2C, stage 3 and resected stage 4 disease, there is very significant risk of developing further metastases, including metastases in the brain. The probability of metastases arising in the brain, of course, go up with stage. The highest risk situation of patients with resected stage 4 disease, where we do recommend surveillance imaging. My personal practice is to do MRI scans of the brain every 6 months. Why is this important? We really want to avoid the catastrophic situation of the first diagnosis of a cerebral metastasis being a bulky, bleeding metastasis that leaves permanent neurological deficit. However, even patients with stage 3 and stage D disease, that's using the new AJCC 8th edition staging, are at significant risk of developing cerebral metastases, and so definitely need to be considered for MRI brain scans, which I perform every 6 months for the first 3 years following diagnosis. The conditional probability of detecting cerebral metastases for patients with stage 3A and 3B and stage 2 disease with negative sentinel lymph nodes is lower, and one should individualise the surveillance based on the risk factors of any particular individual patient.